Hey everybody, Carnivore Mark here, coming back to you with what I had promised. A few days ago, I was able to get you some of my blood results. Again, I'm waiting and I'm dying for the rest of the blood results to come through. The stuff that, I was expecting to see first, but I didn't see first, all that cholesterol stuff, right? But that said, before, I guess it kind of works out because before I find out about these cholesterol numbers of mine, um, I want to get into the study that I came across. It's actually more of a meta-analysis of a history of studies. And so I want to go ahead and share that with you because I found it a very, very interesting read. Now, if you're watching this, you may want to save this, bookmark this. I don't know, save it to your own personal playlist because this might get a little bit long. I'd love to split it up into multiple videos, but I don't know if it's going to do it justice that way. So it's going to be one long video, but hopefully this gives you a lot of good, solid information regarding LDL and what it's all about. So let me start here by going to the top. As you can see, this is from the Expert Review of Clinical Pharmacology, or at least that's where it was published, Taylor and Francis group. And the title is LDLC Does Not Cause Cardiovascular Disease, a comprehensive review of the current literature. I will admit I don't know most of the names on here, but if you're interested in the DOI number and that kind of thing, you have the info right there. I'll also make sure that I link this in the notes as well. So yeah, let's get into some of the interesting things that I found about this. First off, kudos to the authors for being willing to go against the mold a bit. So rather than just going with the narrative and what everybody's been saying for 60 years, they decided to look back into it to analyze what is actually going on, and that they found that the common narrative is actually completely incorrect based on numerous studies over time. So let's go ahead and see what that looks like, see what that's all about. All right. So again, I like in the introduction. Okay, so according to British Austrian philosopher Karl Popper, a theory in the empirical sciences can never be proven, but it can be shown to be false. That's what science is, right? If it cannot be falsified, it is not a scientific hypothesis. So you hear people say, well, the science is settled. It's cholesterol that causes heart disease. Okay. Well, if it's absolutely settled, like how sure are we of that? Well, they go ahead and question that a little bit. The titles here, does high total cholesterol cause atherosclerosis? And here's the TLDR version. No association between total cholesterol and degree of atherosclerosis. So let's go ahead and read the underline that I did here. It says, in 1936, Landay and Sperry found that, corrected for age, unselected people with low total cholesterol were just as atherosclerotic as people with high total cholesterol. So now we ask ourselves, okay, if people on low total cholesterol, or people who have low total cholesterol, had the same amount of heart disease as people with high total cholesterol, then maybe total cholesterol, just maybe, is not where the problem is. So we should be looking potentially at something else, right? So we can go ahead further down here. Okay. So does high total cholesterol cause cardiovascular disease? I'm spelling it out here because in a lot of these studies, you're going to see a lot of abbreviations. So I want to basically spell it out to make sure there's no question there. All right. High total cholesterol causing cardiovascular disease says it's an idea supported by fraudulent reviews of the literature. Ouch, those are some harsh words there. Long story short, for each 1 milligram or mg per dl drop in total cholesterol per year, there was an 11% increase in coronary and total mortality. So that means that as total cholesterol dropped, there was an increase in coronary and total mortality. This seems to be the polar opposite of what is being taught to us or has been taught to us for the last 60 years, certainly throughout my lifetime. And that is, you got to lower your cholesterol so you'll live longer. Well, according to this, and okay, so what is he talking about? He's talking about the study that was conducted in the 1960s by the authors of the Framingham Heart Study. That's where we got our initial information. Oh, total cholesterol, there's a problem with that. However, in their 30-year follow-up study published in 1987, the authors reported that for each drop in total cholesterol per year, there was an 11% increase in coronary and total mortality. I found that extremely fascinating, and I think you should too. Well, I can't tell you what to think, but hey, I find it interesting. All right, so here's the next section, right? The association between total cholesterol and cardiovascular disease is weak, absent, or inverse in many studies. So what does inverse mean? It means exactly what we were talking about. It's backwards. It's the complete reverse from what we are accustomed to. So, well, okay, that's not exactly what it means. Basically, inverse means that instead of following the same trend, say for example, you go up in cholesterol and you go up in heart disease. Instead, it's going the opposite direction. So as you go up in total cholesterol, you're actually lowering your risk of heart disease. As you go down in total cholesterol, you're actually raising your risk of heart disease. So very interesting. It says here, during the years following the report of the Framingham Heart Study, which is where all of our cholesterol myths are based from, says numerous studies revealed that high total cholesterol is not associated with future cardiovascular disease, with the strongest evidence of a lack of relation between total cholesterol and cardiovascular disease in elderly people. So as we kind of look through this, you're going to find that, okay, in 2004, they studied 67,413 men, 82,237 women who had been followed up, found that total cholesterol was weakly associated with coronary heart disease mortality for men, except for those between ages 50 and 64 years. For women, it was weakly associated among those below the age of 50 years, and no association was present after that age. No association was found between total cholesterol and mortality caused by other cardiovascular diseases, except that low total cholesterol was inversely, remember that word, associated with cardiovascular mortality for women above the age of 60 years. So again, this is not anecdotal. This is not simply a fringe study or a fringe evaluation. Let's see, what are these numbers? 67, 82. If I was to kind of estimate, that's over 140,000 people who were really scrutinized as far as their cholesterol levels and as to what's happening there. And they found an inverse association between cholesterol levels and cardiovascular disease. All right. So how about this next section? I'm speeding through this again. If you want to look this up, I get the title in the beginning. I'm going to include all this in the notes as well. I'm just going through here, giving you my take on it. By the way, total disclaimer, got to throw these in. I'm not a doctor. I'm not going to pretend to be one. I'm just a regular guy who loves studying up on my health, especially because I was super unhealthy. And then I was able to completely turn that around after finding the carnivore diet. And carnivore way of eating. To say, if you see WOE way of eating, that's basically what that means. Way of eating. It's just because it's not a diet. I agree with a lot of YouTubers out there, by the way, who say carnivore. They don't like to think of it like a diet, because what is a diet? A diet is usually a short-term kind of thing. Oh, I need to lose 5 pounds. Let me go ahead and jump on this diet, right? So that's what is associated with short-term. But what I'm looking at, and what a lot of my fellow YouTubers are looking at, is the long term. What am I going to be doing or eating in 5 years, 10 years, 15 years, 20 years? What's going to increase my lifespan as I move food into my body? What is going to do the most good and help me spend the most time on this planet here for my friends and my family? And that turns out to be an animal-based way of eating scientifically. You may argue that, that's fine, but this is what I've come across, and I like to bring you studies like this just to kind of show what's going on. Okay, so back to the cholesterol. All right, here we go. Does high LDL-C cause atherosclerosis? Because that's what's been taught. So let's see. If LDL-C is atherogenic, people with high LDL-C should have more atherosclerosis than those with low LDL-C. He's right. If LDL-C was the cause of atherosclerosis, then we would find that people with higher levels would be at a greater risk. So this shows another another study that was done, 304 women. No association was found between LDL-C and coronary calcification. One exception is a 1779 healthy individual. A study of 1,779 healthy individuals without conventional risk factors for cardiovascular disease. And here, the authors found that LDL-C was significantly higher among those with subclinical atherosclerosis. However, association does not prove causation. Mental stress, for instance, is able to raise cholesterol by 10 to 50% in the course of half an hour. And mental stress may cause atherosclerosis by mechanisms other than an increase in LDL-C, for instance, via hypertension and increased platelet aggregation. So that's the other side of things. If you're concerned about, certain things in your blood levels, know that all of these things can be affected by your mental stress, anxiety, all those sorts of things, which, by the way, is another awesome thing about, the carnivore animal-based way of eating, is that just about everybody who gets on it is reporting, myself included, significantly reduced mental stress, anxiety, any kind of worry. It's like everything is kind of clear, when you're going into life, and you can see what's going on. You can manage life so much better. It's really, really wild. So long story short, high LDL-C does not cause atherosclerosis. Okay. Next page. Elderly people with high LDL-C live the longest. You have any relatives older? Well, you might want to let them know, okay? Because they're probably on statins, and we'll get into that during the course of this study. Hang on, I forgot to turn my ringer off. Okay, there we go. All right, so if high LDL-C was the major cause of atherosclerosis and cardiovascular disease, people with the highest LDL-C should have shorter lives than people with low values, right? However, in a recent systematic review of 19 cohort studies, including more than 68,000 elderly people above 60 years of age, we found the opposite. In the largest cohort study, those with the highest LDL-C levels lived even longer than those on statin treatment. In addition, numerous Japanese studies have found that high LDL-C is not a risk factor for coronary heart disease mortality in women of any age. So, by the way, you'll see all these numbers here. If you're not familiar with reading articles and studies and citations, these numbers, this is the 28th document that these authors are citing. So this is not, they're not just speaking an opinion, they're going based on tried and true research and actual, full-on peer-reviewed study. All right, so let's go a little further down. If I'm skipping things, it's just because it's quite a mouthful of stuff that, again, you can get into. I got into a little bit, but I wanted to really highlight the major stuff that I saw in this article. So furthermore, in their calculations, Silverman et al., so they're talking about the study that was going on, up here, they compared the number of major vascular events, MVE, major vascular events, with the relative risk reduction. So this is regarding cholesterol lowering treatment. Yeah, so sorry, I got into the statin conversation without getting into the statin conversation. So cholesterol lowering treatment, we're talking about statins here. And as we go down, we find that they said that Silverman compared the number of major vascular events with the relative risk reduction. The major vascular events is or are of dubious value as a measurement of benefit because they're defined very differently in various trials. So they couldn't even come up with a standard definition of that. So using relative risk reduction as a measure of benefit is also highly misleading, as it inflates the appearance of the rate of event reduction. So I heard somebody, let's see if I can do this justice. I heard somebody put it this way. The way that they market statins to the doctors and ultimately to you is through relative risk reduction, not absolute risk reduction. So that's basically like saying, if I have one, here you go, I have one bottle of water, right? Now, if I get one more bottle of water and add to it, now I have 2 bottles of water, and that is a 100% increase in the amounts of bottles of water that I have. However, if in total there are 100 bottles of water, if I have, I'm surrounded by 100 bottles of water, and I show you one, I say compared to this one, I grab the other bottle of water, that's 100% increase in the bottles of water. That makes you think, if you're not analyzing this carefully, that if you know that I have 100 bottles of water, you go, wow, that risk means that I have 200 bottles of water. No, it's 1 bottle to 2 bottles when you have 100 others. So that's relative, okay, the relative value comparison here. So 1 to 2 is 100%. That's relative. But 1 to 2, when there are 100 bottles of water, means that I only have 1% greater bottles of water than I had before. So hopefully that made sense and did us some kind of justice. But that's what the statins and a lot of medications and these things and pharmaceuticals push when it comes to telling you about your risk. So it's really wild and extremely, extremely misleading. So once again, all right, they have a complex table talking about all these different trials, 30 trials that they refer to. There is no association between LDL-C lowering and coronary event rate. And we'll talk to that point a little bit more. Let's see. Go to page 5. We're about halfway through here. Page 5 of 13. This is one of the tables. I will admit, I started getting to understand this table, and I'm learning it a little bit more. I don't know it enough to be able to break it down for the masses just yet. So just know this info is here. Let's click on that link to go ahead and take a look at these. Let's see. The association between the degree of LDL-C lowering and the absolute risk reduction of cardiovascular health disease mortality in the 21 statin trials where CHD mortality was recorded, and which were included in the study by Silverman et al. and 8 ignored statin trials. So when they were putting the information out, they decided 8 of these studies decided to ignore statin trials. That's crazy. That's dishonest. That's manipulative. That's not giving someone a real picture of what's going on. So absolutely nuts. Let's see. As calculated recently by Christensen et al., statin treatment does not prolong lifespan by more than an average of a few days. I'm going to say it again. As calculated recently by Christensen et al., statin treatment does not prolong lifespan by more than an average of a few days. So you got to ask yourself, statin, is there an absolute risk reduction? It's hardly anything but a few days. And just a couple of percent, by the way. and then they try to scare you by saying, "Oh my gosh, you need this statin, or basically you're not going to be alive anymore." Like, no, it's going to extend your lifespan by a few days. That's absolutely nuts to me, and just it literally does make me angry because I know a lot of people on statins and a lot of people who believe wholeheartedly with all their heart and soul that they need these statins to live longer because that's what they've been convinced. And according to these studies, they're suffering the side effects of these statins without understanding that it's not really going to expand your lifespan. A couple days. I mean, really. All right. So let's take a look here. There's another study by Phillips et al., mentioned in citation number 73. Well, here, let's go back a little bit. See, according to Collins et al., myopathy occurs in only 0.01% of treated individuals per year. Talking about the statins again. But in most statin trials, myopathy is only recorded if creatine kinase is more than 10 times higher than normal, which is an abnormal circumstance. However, in a study by Phillips et al., microscopic examinations of muscle biopsies from statin-treated patients with muscular symptoms and normal creatine kinase levels showed signs of myopathy. It means your muscles are breaking down under statins. This is a normal experience. When patients stopped treatment, their symptoms disappeared, and repeated biopsies showed a resolution of the pathological changes. So statins lowering your cholesterol is actually destroying your body because now you don't have the cholesterol that you need to rebuild your body. To reject the frequent occurrence of muscular problems with the argument that muscle symptoms are nocebo effects is also invalid. In a study of 22 statin-treated professional athletes, the authors reported that 70% or 17 of those athletes terminated treatment because of muscular symptoms, which appeared a few days or weeks after drug withdrawal. So that is, not talking about general drugs, I'm talking about the statins. They got rid of the statins and all their health problems stopped. All the health problems that were related to the statin exposure. The explanation for statin-induced adverse muscle effects is probably that statin treatment not only blocks the production of cholesterol, because it does, but it also blocks the production of several other important molecules. For instance, coenzyme Q10, which is indispensable for energy production. If you don't have coenzyme Q10, you're missing out a lot. Now, what's nice is that the body makes its own. Yes, there's the supplement that you can pick up. People find that helpful who are struggling in that regard, but the body typically does make its own. However, if you're taking statins, you're not going to be making your own. So I don't know. Maybe you can save your muscles on statins by taking coenzyme Q10. I don't know. I haven't seen a study yet to discuss that, or I haven't heard of anyone's testimony or anything like that with that. So let's see, carrying on here. All right, I put a star by this. Let's see what this says. The extensive use of statin treatment may explain the epidemics of heart failure that have been observed in many countries. I mean, think about it. What is the first thing if your cholesterol is a little bit higher than they like? What's the first thing your doctors go to? Take a statin, right? That's everywhere. It's just a multi-billion-dollar industry that got into us to say, take a statin, right? Furthermore, case control and cross-sectional studies have shown that statin use is observed significantly more often among patients, watch this, with cataracts, hearing loss, suicidal ideation, peripheral neuropathy, depression, Parkinson's disease, interstitial cystitis. I don't really know what that is. Maybe you guys do. Herpes zoster, impotency, cognitive impairments, and diabetes. Look, in some of these studies, the side effects disappeared with discontinuation of the statins and worsened with re-challenge. In other words, you're reintroduced to the statins, all those symptoms started coming back. As a matter of fact, they didn't just come back, they got worse. So you jump on statins, and what happens? The body starts breaking down. You get cataracts, hearing loss, unaliving ideas, peripheral neuropathy, depression, Parkinson's. The other thing that I can't pronounce, I'm sorry, herpes zoster impotency, cognitive impairments, and diabetes. All of these things are exacerbated by taking statins. And it says right here, as cholesterol is a vital substance for the renewal of all cells, and since statins also block production of other molecules necessary for normal cell function, it's not surprising that statin treatments may result in side effects from many different organs. I wholeheartedly agree. All right. There is much evidence that low cholesterol predisposes to cancer. Why? Because now your body can't heal itself because it doesn't have the cholesterol that it needs to keep things moving in the right direction. All right. Here's a question. Does treatment with pro-protein convertase, type 9 inhibitors, improve the outcome? This trial is yet another proof that there is no exposure response between LDL-C and total or cardiovascular disease mortality. So I hope by now you're getting the idea, the understanding that cholesterol is your friend, not your enemy. And the last thing you want to do is lower your cholesterol. Somebody commented in a previous video, maybe you're seeing this, or maybe you can relate with this. Say, well, he said this, and said, look, he or she, I'm not sure, they, whatever it might be. They commented saying, look, I had high cholesterol and I just had a triple bypass heart surgery. So what you're talking about is absolutely laughable, or something to that effect. And see, the thing about cholesterol is we need it. Every cell of ours in our body is made at least partially of cholesterol. So when we don't have it, you find all these breakdowns, right, that the statins cause, all the breakdowns in our system. So we absolutely need the cholesterol. But when the cholesterol idea becomes dangerous is when the triglyceride production is up. So when we have a higher level of triglycerides that our body is not dealing with, then those triglycerides interact with the cholesterol. You have oxidation, you have glycation, you have a damaging effect of the LDL-C. And in that case, it becomes actually something else. And the body has a harder time recycling that kind of cholesterol. And this is why we can actually comfortably say that, those of us who, I'm sure, again, I'm waiting for my blood test results, but I'm sure I have higher cholesterol because all I'm eating is animal-related products. I'm eating as much fat as I can possibly get my hands on. I'm doing all these. I'm eating all these things, but all of my blood markers so far showed little to zero risk of developing atherosclerosis or any kind of coronary heart disease. And that's not because I have a low cholesterol, but I have a high level of cholesterol. But my triglycerides are down. That's okay. I'll admit, I haven't seen the test results yet, but all of the other markers indicate that my triglycerides are going to be down. Of course, I'll know that once those results come through, maybe next week. All right, so let's get back to this. So it says here, for instance, why do I highlight this? For instance, according to the Simon Broom Registry, only a small percentage of familial hypercholesterol. Let's see. Let me get you the actual word because it's a mouthful that I always mess up. All right, so they have it. Familial. Okay, that's right. They just threw it in here. FH. Was it familial hypocholesterol? Basically, okay. I have trouble with that word. I have to read it, study it, memorize it, take a test on it. But basically, it's to say that those who have exceptionally high cholesterol. Now we're talking, 500, 600 and above, from what I understand. I've seen some, videos of some people talking about their own FH and how their cholesterol, total cholesterol levels are approaching, they're approaching 1,000 or sometimes a little bit more. So let's see about them. So according to this registry, only a small percentage of these individuals die at an early age, and the mortality among the elderly does not differ from the mortality of the general population despite their high LDL-C. Again, that's an indicator that LDL-C is not a problem. No LDL difference between FH individuals with and without cardiovascular disease. If high LDL-C causes premature cardiovascular disease in familial hypercholesterol, okay, in FH, I'm just going to say FH. I'm not going to try. Maybe a future video I'll try. But if this causes premature cardiovascular disease in FH, the LDL-C of those with CVD should be higher compared to others. But at least 6 studies of untreated FH individuals have shown no significant differences in LDL-C or age 95 to 100. I'm sorry, or age 95 to 100 is a citation. So these individuals have shown no differences in LDL-C. It has been shown that FH relatives without FH, so that's people who are related to the people with FH, may have shorter lives than the general population. So out of all the people who have the highest levels of cholesterol live longer than their family members who have lower cholesterol. Pretty interesting to think about. All right, has CVD mortality decreased after the introduction of statin treatment? So a Swedish study, including 289 of the 290 municipalities, showed that no association was found between statin use and the change in mortality from AMI. That's the study. There's more to talk about that. So the conclusion here is that the idea that high cholesterol levels in the blood are the main cause of cardiovascular disease is impossible, because people with low levels become just as atherosclerotic as people with high levels, and their risk of suffering from cardiovascular disease is the same or higher. So here's the expert commentary. Few authors have adjusted for other cardiovascular disease promoting factors such as mental stress, coagulation factors, inflammation, infections, and endothelial sensitivity, all of which are closely related to LDL receptor abnormalities. So as we read further down, LDL participates in the immune system by adhering to and inactivating all kinds of microorganisms and their toxic products that many observations and experiments have incriminated infections as a possible causal factor of cardiovascular disease. So the more LDL-C you have in your body, the more you're going to be able to fight off diseases and bacteria and microorganisms. You ever notice that people I know anyway, who have suffered from cardiovascular disease tend to get sick a lot? They tend to have to deal with a lot of things like that. Their immune system, their immune health seems to be a little bit lower. Well, here's why. There's not enough cholesterol to work with the immune system to inactivate here. I think deactivate is a good word, or destroy really these microorganisms, bacteria. From what I understand, LDL helps to rip apart these microorganisms at the protein level to recycle into other things that are useful for your body. So LDL, cholesterol, HDL, LDL, they work hand in hand, are your friends, not your enemies. All right, so what do we see here? Statin treatment is prescribed for perpetual use, but very few trials have continued for more than a few years. In the longest follow-up study of 20 years, the authors claim that pravastatin used as primary prevention reduced the risk of cardio health disease by 27% and the risk of major adverse cardiovascular events by 25%. However, these figures represented relative risk reduction. Yeah, the actual risk reduction was only a few percentage points. So I tell you, I'm really upset that the medical community and the scientific community and the drug makers, they know all these facts. They know these things. but they're not sharing it with you. They're giving you the edited, the propagandized, the marketed version. They scare you into taking these drugs for life that are doing more harm than they are good. And this is not, again, I'm a regular guy. I'm not a doctor. I'm not an actual scientist. I'm just reviewing the documentation and the literature and the studies that exist. Okay. Elderly people with FH live just as long as elderly people from the general population despite their high LDL-C. We have shown that high LDL-C levels appear to be unrelated to the risk of cardiovascular disease, both in FH individuals and the general population. So I encourage you, go ahead and find this. This is it's free. Just kind of look it up by the title. So you're just going to scroll through, see what we have. Yeah, these are all of the references studied. Let's see. Oh yeah, look at this, interesting. This review should have stopped statin treatment of elderly people because of 92% of the participants, 19 observational studies. Those with the highest LDL-C lived the longest, and none of them found the opposite. So they should have gotten them off of the statins, but they didn't. They left them on the statins, even knowing that the studies proved that they didn't need them and that they were worse off as a result. That's evil, I think. Let's see. This review demonstrates the many illegitimate ways by which the results from the statin trials are presented. So it goes into, I'm sure, the relative risk reduction. All right, so let's go all the way back here. Once again, this is published in the Expert Review of Clinical Pharmacology, TNF Online, which is Taylor and Francis, and see the ISSN number, and see if I can get you the DOI right there. So again, I'm going to link to all this below. I hope this helped you understand cholesterol a little bit better. The idea of statin treatment, what it's supposed to do, what they claim it does, versus what it actually does. Again, I mean, are there people who can benefit on statins? I don't see it. Maybe. I'm not an actual doctor. I just study what I can. So I can't give you or tell you what to do. I can't tell you take a statin, don't take a statin. I can't tell you eat the carnivore way of life. I can't tell you, that you have to, eat all the fat that you can, and get rid of all the sugar in your life and all the carbs and all those sorts of things, even all the vegetables. I can't tell you to do those things. I can say that I believe you should do those things. I can't tell you to actually do them. So that's my take. You take this for how you want to take it. Quite frankly, it makes me upset and angry that this information is not mainstream. But what can I do except on my little channel here, spread some awareness however I can. So that said, if you appreciated this information, I know it got heady, it got nerdy, but if you appreciate this information, just go ahead, give me a like, subscribe if you haven't already, share my stuff around, help us spread the word about this stuff. I'm going to continue to, bring other studies, bring other ideas, other thoughts. If you have any questions that you want me to look up, I'm happy to do so. If you have questions about my experience, just go ahead and ask. I'm more than happy to help. So that said, I wish you all the absolute best of health, and God bless you. I'll see you next time.